I'm Bernard Tawfik. I'm a medical oncologist specializes in breast and GI cancer at the University of New Mexico Comprehensive Cancer Center in Albuquerque, New Mexico. So COVID-19 and cancer care is really complicated cancer care. Obviously, the immune system is compromised from the cancer itself and then from many of the therapies that we give. So this puts our patient population at especially high risk, and that's been well recognized. And so this is a challenge for us. In addition to those patients that we're taking care of actively, we're trying to be very safely distancing ourselves from our patients who have survived their cancer. And so we're doing a lot of telehealth visits right now with those patients. We're delaying screening tests. And again, we're trying to treat the patients who need to be treated right now as quickly and as efficiently as possible, but at the same time, delaying unnecessary visits if at all possible. I think the biggest thing has been the telehealth visits, which is not something that I would say most practitioners have done, especially not in oncology. So now transitioning a lot of our survivors to telehealth visits and even some of our active patients where we're talking to them, making sure they have their medicines, that their screening tests have been scheduled for some other date, they have refills, making sure they don't have any symptoms concerning for cancer recurrence. I think that's probably being our biggest shift. And we've shifted probably about 50% of our patients to telehealth visits at this time. Our second big shift has been being very cognizant of what treatments we're giving patients. You know, we do have options of different treatments for different cancers, and so sometimes picking the less potent one right this second may be the best idea until this virus pandemic has come to its end. So, being a cancer doctor, I have no end of patients who are worried and anxious because they have cancer. While this virus has definitely added a layer to that, which I am not as informed about or in control of as their cancer, this is something we deal with every day. And so we continue to talk to our patients as often as they need to. We continue to have psychosocial support. We continue to stress to them that we will make this through. We will get through this together, both the cancer and the virus, and we will. And so that's what we continue to stress to our patients during this specific time. There's a lack of significant data out there for patients about COVID-19. It's been very hard for two reasons. One, there's a variety of sources. And two, we don't know everything about the virus, and we're learning new things all the time. And so this is a very challenging situation, not only for patients and medical providers, this is very challenging. And so I think the best thing we can do to support patients is try and give them clear, honest guidelines in a consistently updated fashion. And there are some organizations that are doing that, and so I definitely applaud those organizations. But there is definitely a lot of noise out there, and there's a lot of fear, and we need to calm everything down and give clear guidelines in a consistent way from a medical perspective.